This will open doors in a safe way, and I think this will be really a major breakthrough.
Now, with this consensus, we have common evidence-based and scientific rules.
The literature is there, the biomechanical principles are there. For this group of patients, it's a life-changing treatment, and clinicians must be educated.
Number one is the final observation that there is a high survival rate for zygomatic implants, 97%. Another really important finding is that it requires a highly specialized team to do it.
There is enough evidence to support zygomatic implants as a predictable and safe treatment concept to this group of patients.
The complications exist, we all agreed on it, but they are actually minimal, 3 to 5% at the most, and can be treated if, again, the surgeon and restorative dentist have experience on this procedure.
It gives evidence what to do with the sinus. It gives evidence on the long-term and short-term survival, as well as on the prosthodontic part.
It is the first time that globally recognized experts from across the field of zygomatic implant therapy have been able to come together to look at the available literature and provide their expert opinion into a single manuscript that you, our busy clinical colleagues, can utilize to help make appropriate decisions on whether zygomatic implants may be the right treatment choice for your patients.